Hi, I'm Jennifer Mapalan at the Body Temple Pilates Studio in Indianapolis, Indiana, and I'm here with Mel Mendoza, one of my teachers here in the studio, and we are going to talk about SI joint pain today. You may be someone that may suffer from SI joint pain yourself. This pain may exhibit as possibly pain through the glute area, around your hip, maybe to one side. It may hurt when you walk or put pressure on your foot. So a lot of times this pain can be caused by perhaps imbalances in your hip joint, imbalances in your feet, how you walk, how you run. Maybe you cross your legs a lot. There's a million ways that this joint can get out of balance and cause a lot of pain. We are going to talk about doing some exercises on our guillotine here that we have in the studio, but I'm also going to give you a few exercises that you can do at home. So today we're going to start talking about pelvic stability and lumbar spine lengthening and stability. So I'm going to have Mel bring her feet up onto this bar, and she's going to wrap her toes and lengthen her heels. I have her pelvis set middle line underneath this H bar. We're going to inhale, drive the heels up. As you can see, she's driving it through the back line of her legs into her hamstrings while keeping her hips nice and stable. And you can see that her sits bones are reaching out long and that she's got a nice long length in her back. However, many times people are very locked into their lower backs and they might go into what's called a tuck. So Mel's going to show a little bit of that. So you can see how her tailbone is no longer down, her sits bones are slightly curled up. So she's actually firing up her upper glutes and her lower back, which is going to cause more issues through that SI. So I'm going to have her lengthen back out. And we're going to pretend that there's laser pointers coming out of both sides of those sits bones. And we're going to begin by just pointing and flexing. As she's pointing and flexing, I want to make sure that she's initiating through that back line and she's not pulling into her quad to push through her foot. So we want to make sure everything's tracking. And we're going to do one more. Staying here, we're going to lead from the heels. So she's going to reach her sits bones long and out as she folds to bend on the exhale. And then inhale, reach through the sits bones to the heels to take that bar up. And as she's doing that, not only am I watching the feedback of this bar from side to side, but she can feel that feedback as well to see if one side or another is maybe not staying stable, maybe not tracking, maybe it's lifting, so that she can make some internal adjustments herself and be her own teacher. And we're going to come up one more time to lengthen. And then we're going to exhale halfway down and hold that bar nice and stable. And from here, I'm going to have her take a nice deep breath in. And she's going to exhale, curl her sits bones around and up, keeping this bar stable, creating space from the top to the bottom. And then she's going to inhale and imagine breathing through the back line of her body, and exhale, lengthening out and underneath this bar. She rolls down through both sides of her spine, reaching each sits bone nice and wide. And then inhale, lengthen through the heels to find a nice long stretch. And one more time. Exhale, bend. Full breath to curl the hips up. Inhale, feeling more space in the back as you roll down. Reach into that right side a little bit longer. Good. And a full breath to come back up. Thank you for joining us today.